Hello everybody and welcome to today's lecture. Today's topic will be on the 17-segment model of the heart and coronary artery distribution. Let's begin. So we'll start by talking about our learning objectives for today. So essentially we're going to explain why sonographers use this 17-segment model of the heart. We're going to learn how to identify the segments and the walls. And we're going to identify the coronary artery distribution to these individual segments. So what is the 17-segment heart model? Well, essentially, it's a standardized model which is used to describe the systolic function of the left ventricle. So as we can see here in our apical four-chamber view, we know, of course, this is the left ventricle. So this is essentially what we will be discussing. As well, this 17-segment model helps an echocardiographer describe a particular location of the ventricle. So let's say I was doing my scan and this person had had a heart attack and part of their myocardium was thinned. It's akinetic, it's not moving. How would I describe that? How would I say describe this exact segment right here? We need to be able to. Another reason why we use this model is that it helps with inter and intra-modality comparison. So what I mean by that is, let's say if I'm scanning my patient and I notice that he has something happening in this segment of his left ventricle. Say if he went to another clinic and was scanned again, and now they've realized, oh, well, something's happening here, and something is all happening along the apex as well. So we need a way to be able to essentially compare between different studies and between different modalities. So possibly with cardiac MRI or a CT. So if we have a standardized way to describe these different segments of the left ventricle, it helps us a lot, essentially. And the reason why there's 17 segments is because the heart is three-dimensional. So even just looking at this four-chamber right here, this is only one slice of the heart. Maybe it might look as though all segments of the heart are contracting normally in this view, but perhaps if we looked in a two-chamber view, we might see an issue on one of those segments that we wouldn't necessarily see in a four-chamber. So why should we use this model? So essentially, heart failure or systolic dysfunction can occur in the left ventricle either globally or segmentally. So what I mean by that is that essentially the heart is a pump. So during systole, the heart is contracting and it's pumping blood through the aorta to the rest of the body. And if one of the arteries is blocked, or if they have some sort of diseased myocardium or coronary artery disease, this can affect the left ventricle. And this can either happen on a global scale, where all the segments are affected, or it can happen to just certain segments in particular. So we also use this model because if we can remember, the heart is essentially, the myocardium and the heart muscle is fed by coronary arteries. So different coronary arteries feed different segments of the left ventricle. So if we just go back to our image here, let's say again, if this segment of the heart just wasn't moving properly and it's not contracting properly, what does that mean exactly? So, okay, fine, we can describe it, but what does it mean? What coronary artery is that potentially related to? So we can then potentially essentially deduct what coronary artery has the issue without even doing an angiogram or without looking specifically at the coronary arteries. So we'll just briefly review our coronary arteries here. So as I mentioned before, this 17-segment model, we do reference the coronary arteries. Essentially, we can see our heart here. We have our aortic root, and off of our aortic root we have our coronary sinuses, essentially, that come off. So if we remember, essentially we have a left main coronary artery and a right coronary artery that come off of this aortic root, and essentially this right coronary artery supplies the right ventricle, the right atrium, and part of the left ventricle as well. So the left main artery branches off into the circumflux artery and this left anterior descending coronary artery. So the LAD, this sometimes is known as the widowmaker. So let's say if somebody had a blockage up here, you could imagine how much of the artery would be affected, essentially, and how much muscle wouldn't be getting proper blood flow. So this left anterior descending artery essentially supplies much of the left ventricle, and we'll get into which parts in a little bit. This circumflux artery also branches off the left main coronary artery, and this feeds part of the left atrium, and it also feeds part of the left ventricle and papillary muscles. So we also need to remember that coronary artery distribution is variable among individuals. So not every single person has this arrangement. There are some deviations within that, but generally most people would have at least a right coronary artery, left anterior descending and circumflux. Moving on. So 17 segment model of the heart. This is essentially what I'm talking about. When we look at this on first glance, it looks pretty complicated. What can we see when we first look at this? Well, we can see that we have several different, essentially 2D views here, and different cross sections of the short axis. So we have our peristernal long, peristernal short axis at different levels, so kind of that mitral valve level, papillary muscle level, and that apex level. And then of course we have our 4-chamber, our 2-chamber, and our long axis. Great, easy, we know that. So then what do all these numbers mean? Well, essentially we need to discuss what the different walls are called. So let's break this down. First, when we're talking about this 17 segment model, we basically describe different segments and walls. And these walls essentially can be divided into segments. So what I mean by that is if we're looking at our apical 4-chamber here, we see this interventricular septum right here, and we can see that it's been broken into essentially thirds. So these segments essentially have different names. So we have our basal segments, our mid segments, and our distal or apical segments. And right here, the very, very tip of our apical 4-chamber, that's called the apical cap. So basically what you need to know is that these basal segments are closer to the valves. We have our mid-level segments and our distal or apical segments. So if we're looking at our peristernal long axis, we can see we have our basal segments, our mid, and our apical segments. Basal, of course, being closer to the valve. All right. So let's break this down even further. So if we're looking at our peristernal long axis right here, essentially we need to know how to describe these walls. So all of the walls of the left ventricle in the different views have different names. So if we think about essentially our image orientations, we know that this is the anterior portion of the image, this is the posterior portion of the image. So it isn't that simple when it comes to naming these walls, but it's pretty close. So essentially here we have our anteroseptal wall. So because this is anterior portion of the peristernal long axis view, essentially, and it's the septum, so it's the anteroseptal wall. Down below we have our posterior wall, or typically within this model we call it our inferolateral wall. So that's just, it's good to know. You will need to know essentially that these two names are interchangeable. So I could say, okay, this is the posterior wall or the inferolateral wall. Moving on, what about our apical forechamber? So what is this wall called here? So this is essentially the anterolateral wall, as we can see right here. And here we have our interventricular septum. That is not the name of the wall. It is the inferoseptal wall. Okay, so essentially the septum, if we think about it, we can see it in multiple views, and there's different planes. So here in the peristernal short or peristernal long axis, we have this anteroseptal wall. In our forechamber, we have our inferoseptal wall and our anterolateral wall. So when we look at our two-chamber, what do we have? So we have our inferior wall, which is right here and right here, and our anterior wall, which is right here and right here. So of course, then looking how this is essentially divided into different segments, we would be able to say that this is the basal inferior wall, this is the mid-inferior wall, and this is the apical inferior wall. And this, of course, being the apical cap in all views. Same with the anterior. So we have the basal anterior, mid-anterior, apical anterior. All right. So what about when we're looking at short axis? So this model right here can look a little bit complicated because we are just looking at essentially this mid-level peristernal short axis, and essentially we can see all of the walls at once, just at the mid-level. So if we kind of follow this around, we can kind of break it into segments. So if we start right here, so essentially this is our anterior wall. We have our anteroseptal wall, our inferior septal wall, our inferior wall, our inferolateral wall or posterior wall, and our anterior lateral wall. So I think now at least you can appreciate that there's almost two segments to the septum. So we have this anterior portion and this inferior portion, and just going back, we can now kind of appreciate. So we have this anterior septal wall, and we have this inferior septal wall, and in cross section we can see them right there. All right, so let's put this together. Essentially, if you can remember the difference between basal, mid, and apical / distal segments and the different names of the walls, you can use this model. So it's not like there's 17 individual different names. Even though there are, I suppose, it's almost like a puzzle and you can put it together. So let's look at these segments here. So if we think about our basal, mid, and apical walls, so right here we can already tell, so we have our basal, mid, apical, that this is going to be a mid-level segment. And right here, if we can remember, that's kind of that 17th segment, and this is the apical cap. So what about this wall? So it would be the mid what, essentially? So looking back at this, here was our mid, we have our different walls here. So it would be the mid anterolateral wall, looking at this. So we have our mid anterior lateral wall and our apical cap. And of course, let's remember that we can see the same mid anterior lateral wall in short axis. So this segment right here is exactly the same as this, except a cross section. So we're essentially cutting it in a different plane. what are these segments? All right, so if we're looking here, we can basically deduct that this is an apical 2-chamber. You can see the left atrium appendage right here. Here's the left atrium, here's the mitral valve. So what about this one? So with the 2-chamber, we know we have an inferior and an anterior wall. So we have our basal segment. So this would be the basal inferior wall segment. And over here, we have basal, mid, apical. So this would be our apical anterior wall segment. Right? So we have our inferior, anterior, so basal inferior wall, and our apical anterior wall. All right, so just going back to this model here, hopefully now this just makes a little bit more sense. So although these numbers aren't exactly in chronological order, I suppose, it doesn't really matter. You should be able to just point to a segment and say, okay, well, I know that this is the basal segment. I know that this is the anteroseptal wall. So this is the basal anteroseptal wall or segment. And this number 2, we can see then, of course, corresponds to right here, which is in this basal cross-section. And of course, if you can remember, the long axis. So the long axis is essentially the same as the peristernal long axis, except it has been rotated from the peristernal long axis rotated essentially 90 degrees. So all of these walls are generally the same. So again, we have our basal anteroseptal wall. Here's number 2, basal anteroseptal wall. So these are the same segments that we can see. The only difference is, of course, in long axis, we can see this apical cap. Okay. So going back to coronary artery distribution for a minute, let's remember this. So we have our right coronary artery, our left anterior descending, and our left main. So how do we put this into the 17-segment model? Essentially, here's our model again. And now we can see that the different coronary arteries essentially correspond to different walls of the heart. So we can see this anteroseptal wall is blue. It's pretty well always fed by this left anterior descending. The anterior wall here, blue, left anterior descending. Okay. If we look at the inferior wall of this 2-chamber, we can see that the basal and mid segments are almost always the right coronary artery. Okay. But looking at this apical segment, sometimes there's variation, as I mentioned. So this apical segment, it could be an RCA or it could be fed by the left anterior descending as well. So that is true, of course, then of the anterior lateral wall. This could either be the left anterior descending or the circumflex artery. Okay? So, of course, essentially this is useful for if you were scanning a patient and you saw essentially they are in heart failure, they don't have normal systolic function, their heart isn't contracting normally in this anterior wall, and then you could likely then be able to say, well, they likely have an issue with their left anterior descending. Of course, they're going to end up going for an angiogram if this is not a known issue. So let's relate some more images to the coronary arteries. So again, what segment is this? So we have our peristernal long axis here. And what is this? So we know that this is the basal segment here, right? So this is the basal anteroseptal segment. And what coronary artery is this likely to feed? So let's take a look. So looking at our 17-segment model, we can see right here, basal anteroseptal, oops, there it is, that one. And then looking at our coronary artery distribution chart, remembering that the long axis is the same as, the parasternal long axis is the same as the apical three-chamber essentially. So we have this basal anteroseptal segment, and that relates to the left anterior descending artery. Here we go. So we could say that's the basal anteroseptal segment, and it's likely supplied by the LAD. I know a lot of this may sound like a bit of a foreign concept, or it would be likely difficult for you to recognize systolic dysfunction and heart failure and that sort of thing at this point. And that's completely normal. We haven't started to learn that yet. But what I do want you to be able to recognize is that essentially the different views have different walls with different names, and we can divide those essentially into segments, and that these segments are fed by different coronary arteries. So essentially the takeaway from this lecture is just to recognize the different walls in standard 2D views. So for instance, the inferior wall, what view are you going to see that in? You're going to see that in the apical two-chamber, things like that. I want you to be able to recognize which walls you see where. Recognize the levels of basal, mid, or apical. I tend to say distal, but that's just me, and possibly my North American ways, I don't know. And I'd like you to be able to determine the likely coronary artery that is supplying the described segment. All right, that is all for today. Thanks for listening.